Good morning, everybody. We'll begin just shortly. Thanks for your patience.
Hey, Corey, I'm on. I don't know if you can hear me.
I have you loud and clear.
Perfect.
Right. Give me one moment and we'll begin. Good morning and welcome to the Wednesday, February 2nd, Washington State Department of Health media briefing. I'm Corey Portner, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Lacey Fehrenbach, Deputy Secretary for Prevention and Health, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, and Andrew M. Rose, COVID-19 Incident Commander. To begin the briefing, we'll open with remarks from Secretary Shah.
Great, Corey. Thank you so much for kicking us off. And I also want to, again, thank my fellow panelists for being here this morning. And certainly I want to thank our media partners, as always, for joining us. And I really want to start by saying that this is the beginning of the Lunar New Year. And as you know, this is the year of the tiger. And I think many of you know on social media, I've been following the Bengal Tigers in Cincinnati as they get into the Super Bowl. So I would be remiss if I did not wish everyone a happy Lunar New Year, but also wish the Bengals all the luck against, by the way, an NFC West opponent in the Super Bowl. I also want to acknowledge the beginning of February as Black History Month. This year's theme for Black History, as you know, for this month is health and wellness. And we want to acknowledge the incredible contributions that the African-American community has made, not just to this nation, but as we know, throughout health and medicine, as well as knowing that we have a long way to go still to close gaps on inequities throughout our nation. But I want to commemorate both Lunar New Year as well as Black History Month as we get started this morning. So let me move to a few things that I want to talk about. And then I'm really going to turn it over to Dr. Lindquist to go into detail on trends. And obviously you've heard with both Michelle and Lacey being here, they're going to be talking about specifics related to both vaccines as well as other information related to our response. I want to say that we are hopeful. There is some good news that we're starting to see when it comes to the trajectory of cases related to Omicron here, not just in the state of Washington, but across the nation. That is welcome news that the trajectory of these cases and our trends appears to be on the downturn. And that is really what we all will welcome. That means that the numbers have started to level off from what we were seeing during the holidays and the early part of January. And as you know, we had said it was going to be a several week turn, couple of months where we were going to have some difficult times, and that's what we are seeing. At the same time, we're also seeing some hopeful news when it comes to hospitalizations. This is particular, if we could show the graph, Corey, if that's okay. I want to just highlight the fact that certainly we are still at an incredibly high number when it comes to hospitalizations. And while it looks like it continues to, the trajectory show that it's on the upswing, it does appear that we're starting to see some hopefully leveling off that's beginning, that the slope, the delta, if you will, going up is now started to crest, and we're hoping that we're going to now start to level off and start to see declines. This is more pronounced in Western Washington, although it is very busy right now in the hospital system in Western Washington as well. But we're also seeing at this point increases in Eastern Washington, and we do believe that Eastern Washington is going to lag in its hospitalizations and before it starts to see some leveling off as well. Now, we know it's an ecosystem. What happens in Western Washington or Eastern Washington or Northern Washington or Southwestern Washington or Central Washington, it's all interconnected. And so I think it's really critical that we remember all the different messages that we have continued to put out there, including only going to the emergency department and going into the healthcare system if you have a true emergency. And the reminder of the message is that that's not the place, especially if you have no symptoms or mild symptoms, or you feel you've been exposed, but you're just not sure. That's not the place to go to be checked out. We would rather that you contact your primary care healthcare provider. You may contact with your local health jurisdiction, local health department, or you contact Department of Health here at the state. We want to make sure that we are being as mindful of what needs to happen in the hospital setting, and that we're only going to the hospital unless we truly have an emergency. If I can shift to the testing portal, I want to give so much credit to our teams, not just at Department of Health, but Care Evolution and Amazon for the incredible partnership, and also for the yeoman's work to be able to get tests out as quickly as possible. As you know, our goal has been to meet the governor's request to have 3.5 million tests out to Washingtonians. And we have said throughout that this is going to be dependent on supply and procuring the supply. But there was a second tenet that we used as we move forward with this initiative, which was as we got a mass of tests, we weren't going to sit on them or put them in a warehouse. We were going to try to get them out as quickly as possible. And that is what we did. When we initially opened the portal, it was about 850,000 tests that were able to go out. But in addition to that, another 650,000, so a total of 1.4 million tests that have gone out have already been shipped. And we also see that there is going to be, as we open the portal up earlier this week, yesterday, we had another 650,000 tests that were ordered. And so now we are at that 1.5 million of, the 2.1 million of the 3.5 million, and we have an additional 1.4 million that are going to now be in the mix for us to continue to procure and be able to get them in and get them out. So we're very happy to see that of the 3.5 million, that 2.1 million are on their way or have already been received by people. And you've seen many messages by people who receive those within a day or two of the ordering. And I just want to thank all of our partners for the success of this program thus far. The other thing I want to shift to is this real question that we've been getting a lot about: is the pandemic ending, and where are we with the pandemic and all the different activities that are related? And we do know that both all the tools that are related to vaccines and wearing of masks and the policy tools, as well as the rapid spread of Omicron across our state, has given us a tale of two responses. On the one hand, we have had success, and we've been very pleased with that. But on the other hand, we're also guarded because we are concerned about what we're seeing with increased numbers of cases, and obviously, as I mentioned earlier, hospitalizations. We still remain in a difficult situation with our healthcare system that's being stretched and strained, but we're starting to see the light at the end of the tunnel. And what that means is that oftentimes people are asking us, well, when is this going to end? And we don't have a crystal ball, of course, but what we are saying is that we do think that that movement, as you've been reading in the literature and across the country around endemic, or when we're going to be living with COVID, that these are the pivots that we at Department of Health are also incorporating, not just in our messaging, but in also our activities. Absolutely, we're trying to do our best to provide the tools and the information to the public so that they can also be empowered to be able to make good decisions and also be able to know what they need to do in order to be able to respond to this pandemic in this phase. But at the same time, we also recognize we're still in a difficult situation. And so I do want to now move to a specific comment, which is related to donation of blood. People are often asking us what they can do to help in the midst of the pandemic. And, I just want to thank everybody for, everybody doing what they can, first of all, to wear their masks and, making sure that they're upping their mask strategy and being careful of crowds and indoor settings and all sorts of things. And we do recognize that we can do these things, but we need to make sure that we're doing these things safely and an eye towards how do we have the kind of safety and health in mind of not just ourselves, our family members, and obviously those around us. But in addition to that, we are now starting to see shortages of blood throughout our region. And in fact, this is happening across the country. So I do want to just make known that we are asking Washingtonians to consider donating blood right now and really making an impact with the shortage that we have. Bloodworks Northwest has said that their local supply has really hit an emergency level. They're asking everyone who's feeling healthy, especially those who are O negative, O positive donors, to please schedule a donation as quickly as they can, and especially over the next several weeks. Please make an appointment, and there's information here on how you can do that by phone or by the web link, and we would ask our media partners to be able to get that information out. So again, as we start to think about where we are with all sorts of different concerns and issues related to this pandemic, I think the biggest thing that we're starting to see is some leveling off in our healthcare system, but it's far too early for us to say we've had success and we're out of the woods, because we still are seeing increases that are really challenging in Eastern Washington. And then in Western Washington, as you know, that just because we're starting to see leveling off, that does not mean that people are not in the hospital for an extended period of time or straining the system as we have it. We're also continuing to do our work in schools and our work around making sure that we have the tools available to our local health departments, as well as obviously our community members. And I think it's going to be important for us to continue that fight. So with that, I just want to say thank you again. And I'm going to turn it over to Dr. Lindquist to go through some specific trends.
With that, next we'll go to state epidemiologist, Dr. Scott Lindquist. Go ahead, Scott.
Hi, well, let's jump into the specifics here. Remember, it takes a team to generate the data that we're showing here. So Lacey and Andy, feel free, or Michelle, feel free to jump in for any clarifications. But let's have this first slide, which really shows us our cases. And what you're seeing here is a downward turn in our number of cases. We are hearing from a lot of our folks in the field that are doing most of the testing that they are clearly seeing this. I know in my own clinic, we are really seeing a dramatic decrease in the number of people being tested and the number of positives, as evidenced by this. Reminder that these gray bars to the right are incomplete data. They can go up, but it appears to be the trend is going down at this point. So this is what I affectionately call light at the end of the tunnel. Of course, Lacey always reminds me the light at that end of the tunnel could be a train coming. So we'll reserve some comments here, but it is all very promising. We don't see any evidence of a new variant or increase in cases coming. So I don't think it's a train at the end of the tunnel. I think it is truly a downward incidence of our cases. So with the next slide, you saw this earlier. Go on to the next slide. This is the hospitalizations. It's not, hospitalizations usually follow about a week behind any of our cases. So we're not seeing this downward trend yet in hospitalizations, but again, this is what looks to be a stalling out of our hospitalizations. This is also very good news. And the caveat to this, of course, you guys, is that Western Washington is different than Eastern Washington in both our cases and our hospitalizations. And when we look at these numbers, these are the state as a whole. So we will likely see a lag in Eastern Washington in the decrease in cases and hospitalizations, and it'll make the overall rate in the state look like it's going down slower. But this is promising. So next slide. What is of concern, but not totally unexpected? At the end of this, what we call these are epicurves. At the end of this epicurve, we see an increase in the number of deaths. And that's not unexpected with the volume of cases that we're seeing, but the death rate does not appear to be as high as with the other variants. But I'm concerned that we are in this gray area going to see quite a few more deaths still reported. So to everyone who is saying, hey, look, it's great, it's getting better, it's not a big issue, we're having between 50 and 70 deaths per day. So this is still a very significant pandemic at this point. It's just got some signs of it going down. So next slide. And again, what's holding true, this isn't opinion or science. This is what we're actually observing here in Washington State, that the hospitalization rates for those who are unvaccinated during this Omicron are 5 times higher for those in the 12 to 34 age group, 7 times higher in the 35 to 64-year-old, and 8 times higher in the 65. This is the observations that really drive our biggest recommendation, that your best protection against hospitalization and severe disease, even from this more infectious Omicron, is to get vaccinated and boosted. Next slide. And here it is graphically, you guys are seeing this. This is the case rates in those 65. The lower lines are the fully vaccinated or partially vaccinated versus the red line, which is unvaccinated. And that's a 5 times difference. I think if we were to tell people you had a 5-time risk of getting in a car accident, you probably wouldn't get in your car. So don't get in your car without getting vaccinated here. Next slide. And this is the hospitalization rates, 8 times higher. Go ahead to the next slide. And here we are, the death rates. Now it's very hard to calculate death rates in the younger age groups because the volume or the number is so small. But in these, where most of the deaths are occurring, in these 65 and older, you're 9 times more likely to die if you're unvaccinated. So that is a very significant observation here in Washington State. Next slide. And we'll switch over to Michelle here in a minute to talk about vaccines. But the last thing I want to leave you with is 100% of all our variants at this point. We still have a very robust genotyping program. 100% of our variants are still the Omicron. I know there's a lot of question about a sub-variant of Omicron. It is the same virus. It is the same variant. It's just a twist on that. We are not seeing a lot of these, nor are we really getting into the reporting of these every day, because clinically it has not been proven to be any difference. This is the same Omicron variant that we've seen the whole time, and that's 100% of what we're seeing. I am hoping, and I am hearing some preliminaries, that clinics are starting to decompress a little bit And some of our hospitals are getting a little more breathing room as these case rates and hospitalizations go down. I think, though, as a state, we're into this together, and we're really going to have to lend a helping hand to Eastern Washington to help them get through the hump as we have in Western Washington. And with that, I turn it back to you, Corey.
Thank you, Dr. Lindquist. Next, we'll go to Deputy Secretary Lacey Fehrenbach.
Thanks, Corey. I am the Deputy Secretary for COVID-19, Lacey Fehrenbach. Very pleased to share a little more on the Say Yes COVID home test program. Very grateful for our partnership with Amazon and Care Evolution and the interest in this program that Washingtonians have expressed to date. As you heard Dr. Shaw say, we have continued to see very high demand for at-home tests and also tests broadly, despite a really strained supply of tests nationally. Even with that, we have served more than 460,000 households with those 2.1 million tests that have arrived or soon will arrive into those homes across the state of Washington. We are hoping to reach another 280,000 households with 1.4 million tests for a total of 740,000 households statewide. There is the possibility that we could expand this program further. It really just does depend on how we navigate supply chain challenges. While right now at this moment, we don't have additional tests to distribute, people can still access COVID-19 tests through a number of other channels. So one, if you haven't, you can order your free test kit from the federal program at covidtests.gov. You can purchase an at-home test at local retailers or pharmacies. And if you have health insurance, most plans are required to directly cover or pay you back for up to 8 at-home tests per month. And of course, you can find a community-based test site, local pharmacy or clinic. And there's a listing of those available by geography on the DOH website. A quick reminder that at-home tests are a convenient public health tool that give us information to take action quickly to care for ourselves if we have COVID-19 and protect others from spread. So it is possible to report your positive result through the state's COVID hotline, and that number is 1-800-525-0127. Again, 1-800-525-0127. We also encourage all smartphone users to download or enable WA Notify, not just for exposure notifications, that is the primary purpose, but also the ability to plug in your positive at-home test results. Lastly, if you have symptoms of COVID-19 and cannot find a test through any of these channels, please act as though you do have COVID and isolate at home, monitor your symptoms. If your condition worsens and you need medical care, please start with your primary care physician, but certainly if it's an emergency, go to the emergency department. I just want to wrap up and express my gratitude to Washingtonians for getting vaccinated, boosted, wearing your masks, using WA Notify, and getting tested. We know that it has been a long 2+ years. We know that it has been a very, very hard start to 2022, but urging you to keep it up. You are helping us turn the tide on Omicron. You are helping us keep our students in school and safer in schools, and you're helping to keep our health system available for people who need critical care. And I do want to put in a plug for donating blood and thank those who have donated blood recently and encourage anyone who is healthy, especially those of you who, like me, have type O blood, to make an appointment to donate soon. In less than an hour, you can truly save a life. Back to you, Corey.
Thank you, Deputy Secretary Fehrenbach. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, good morning, everybody. Great to be with you again. I also just want to acknowledge the Lunar New Year and Black History Month, and really share that this year's theme for Black History Month is health and wellness. I just want to acknowledge, all of us do, the many contributions the Black community has made to this nation, and realize we have a lot more work to do to close disparities in health outcomes, and we're committed to doing that work together. As you know, I lead the state's COVID-19 vaccine and planning distribution team. And so I want to start today also by going over our vaccine numbers. So across the state, we've given out more than 12.7 million doses of COVID-19 vaccine. And this is protecting more than 5.7 million people from the worst outcomes of this disease. Nearly 80%, we're so close to the 80% line of people 5 and older have received at least one dose of COVID vaccine. That's incredible. That means the vast majority of people who are eligible for vaccination in our state are going out and getting vaccinated. We'd love to close that gap and bring that to 100%. And more than 72% of those who are fully vaccinated. We also had some good news at the start of this week. The FDA, the Food and Drug Administration, announced Monday that they've granted full approval to the Moderna COVID-19 vaccine. And this vaccine has been given to tens of millions of Americans since its emergency use authorization over a year ago. This action by the Food and Drug Administration means the agency has completed the same rigorous, time-consuming review of Moderna's vaccination as dozens of other long-established vaccines. And FDA, this means we now have 2 fully approved vaccines for use here in the US, being the Moderna with this news, and the FDA granted full approval of Pfizer's vaccine last August. Couple other updates about things going on and how we're working to make sure the public and everybody in the media and all of our partners have the information to the most data we could provide. So within the last week, we've added pediatric vaccination and additional doses to the state's data dashboard. So when you click on the vaccination tab on the COVID-19 dashboard, under how many people are getting vaccinated section, you'll see additional doses in the left-hand column. We've also updated the population to include everybody aged 5 and older, since that's a group of people who are eligible for vaccine. And to break it down even further, you can now see how many kids aged 5 to 11 have been vaccinated on the state and county levels when you click on the Who is Getting Vaccinated tab. Adding this data to the dashboard helps paint a clearer picture of vaccine distribution and uptake across our state. And I want to say my sincere thanks to everyone who's protecting themselves and their loved ones by getting vaccinated. So speaking of additional doses, I also want to clarify who's eligible for a booster dose and an additional primary dose, and why it's recommended that certain immunocompromised people receive a 4th dose. We know people who are immunocompromised are more likely to catch COVID-19 and get seriously ill. CDC recommends some immunocompromised people ages 5 and older receive an additional primary shot or 3rd dose of vaccine 28 days after their 2nd dose of Pfizer or Moderna vaccine. 5 months after the primary series is completed, everyone aged 12 and older should get a booster dose for additional protection, which means someone who's immune compromised who received a 3rd dose earlier would receive a 4th dose as their booster dose when they're eligible. Immunocompromised people who receive the Johnson & Johnson vaccine do not need an additional primary shot, but everyone who received J&J should get a booster dose 2 months after completing their primary vaccination. If you have questions or are looking for further clarity, because that's a lot of information, we've got much more detail and specifics and frequently asked questions on our Department of Health's website. Okay, let's talk a little bit about pediatric vaccines for kids under 5. Like many of you, we're eagerly awaiting the news from our federal partners about when vaccines will be available for kids under the age of 5. Yesterday, Pfizer announced it submitted additional data on the safety and efficacy of its vaccine to the FDA for kids aged 6 months through 4 years old. We'll continue to follow guidance and recommendations from the FDA, the CDC's Advisory Committee on Immunization Practices, and the Western States Scientific Safety Review Work Group. We hope to have more information in the coming weeks, and as soon as we have an update, we'll share it with you. Until then, let's continue to get our eligible children vaccinated. So far, about 400,000 kids aged 5 through 11 have received at least their 1st dose of COVID-19 vaccine. which is a little less than 60% of that age group. We want to get those numbers as high as possible to protect our children and keep them in the classroom and taking part in activities they love. So to help find vaccine locations near you, visit the state's vaccine locator or vaccines.gov. If you have questions or need help making an appointment, please call the state's COVID-19 hotline at 833-VAX-HELP. Thank you. Back to you, Corey.
Thank you, Assistant Secretary Roberts. This brings us to the Q&A segment of today's briefing. We have a number of reporters in the queue, so we'll try and keep it quick, but if we're unable to get to you, or should you have a question after the briefing's over, don't hesitate to reach out to us at doh-pio@doh.wa.gov, and we'll make those connections. Our first question comes from Ariel Dreyer with the Spokesman.
Thank you. Dr. Lindquist, you mentioned this briefly earlier. I just was hoping you could elaborate a bit more if the Omicron subvariant is something to be concerned about as it pertains to a potential next surge or maybe a prolonged surge in cases as we've seen in some other countries.
Yeah, I don't think we are seeing that at all. Quite frankly, the only reason we know about this subvariant is we have the technology to look for it. I think if we would have been doing this a year ago, we wouldn't have even known about this subvariant. So I don't want us to chase our tails with reporting numbers of every subvariant, because every variant has a subvariant. I'm not quite so interested in this one unless it has clinical implications, which it has not shown to be clinically important at this point.
All right. Our next question comes from Nicole with Cairo Radio.
Good morning, everyone. I noticed that you've been telling everyone, if they can, to get N95 masks. But recently, the State Hospital Association said that there aren't enough N95 masks for healthcare workers in the hospitals because members of the public have been buying them up. So is that still your advice to everyone? And how are you going to make sure that the hospitals have enough N95s?
Yeah, Nicole, thanks. I'll take this on. Maybe Lacey or Andy, you might want to just add into it. What I would say is, first of all, Governor made it very clear that we were going to get masks out from our supply of masks as Dr. Lindquist gets his mask on. He wants to demonstrate the proper usage and wearing of the mask, and also that he has one available as a healthcare provider. So that's great. Thank you, Scott. Governor had made it clear that we were going to work to get 10 million masks out. And I don't have the exact update, but we're pretty close to hitting that mark. And I will say a few things about this, that we have said to people that the best mask is the mask that you're going to wear, and you're going to wear properly, and you're going to wear it in the settings where it is necessary to wear a mask. And that means obviously indoors. So if you have an N95 and you're not going to wear it properly, honestly, that is going to be less than effective. So what I would also remind everybody is our other message, which has been about that if you do not have access to an N95 or the other kinds of upgraded masks, I did want to make it known that what we have said is that you can double up cloth masks. It's not ideal. I want to be clear. It's not ideal, but you can double up. You can take a surgical and put it on top of a cloth mask. I mean, there are things that you can do. I'm sorry, a cloth mask on top of the surgical. You can do things to make your safety more paramount. I think it's the context, Nicole, where we want to really make sure people are recognizing, absolutely, there are going to be certain settings, like a healthcare setting, when an N95 is absolutely what somebody should be wearing. There are other places where people are wearing, as you can see, the KN95s or KF94s and or surgical, or taking surgical and adding something on top of it, or what have you. So there's a lot that's there. And I just want to make sure that we're clear to people that the key message is to not panic and to be really appropriate with what you're doing, and know your risk, know the activity, and know what you're going to be doing in that activity. So when Dr. Lindquist is seeing a patient, absolutely we want to make sure he's got an N95 and he's ready and he's prepared, not just for his patient and their health and well-being and safety, but also his own. And that is also very different when you're going to a very crowded setting indoors. You're going to be there for a length of time, and at that point you may want to consider having a higher grade mask. But if you're going outdoors and or going where there's not a lot of people or everybody is vaccinated and boosted, and there are other kinds of things that you can do to make sure that the supply of N95s are available to our healthcare workers. So I do just want to make sure that people know it's a nuanced message, Nicole, and that's the challenge. Whenever we have nuanced messages, then it becomes it feels that we're not providing enough information, but it's just really complicated. But it's just simple. Make it very simple. Wear a mask. Wear the best mask you can, but wear it properly. Make sure you wear it in the right settings. Make sure that you're not taking chances when you're going into settings that's gonna potentially have risk there. That's where you want to really be thinking about it. So we want to make sure people are using good tools, information, and knowledge so that they can help us and help themselves in the midst of this pandemic. So Lacey, Andy, anything you guys wanted to add?
Yeah, thanks, Dr. Shaw. I'll just add real quick, we continue to maintain a state backstop of PPE that includes masks to help support in situations like this. We do have avenues in cooperation with our local emergency management, local public health, state agency partners, our community-based organizations, and others to continue to assess the needs in the community and provide a way for them to order any supplies that they need to help support with masks, whether it is surgical masks, KN95s, KN90s, or N95s, as has been mentioned by Dr. Shaw. So that process still exists, it's still in place. If a hospital system is in need of PPE, they have the same access to that state backstop as well. Just a reminder that N95s are very unique. There is a lot of different makes, models, and types that for the clinical setting need to be fit tested to. So we will work as the best we can with our hospital system to provide what we have in our backstop for them to access. But that system still exists and still available from the community-based perspective all the way up through our hospital and healthcare system to be able to access the state backstop.
Yeah, I was actually demonstrating a KN95. So as a healthcare provider, I am fit tested where I go through an actual fitting of the right brand of mask with the right size. I put it on. You make sure that you don't breathe in a chemical that irritates you. That's called fit testing. That's a very, very different mask than what the public is buying. And that's what I put on earlier is a KN95. So when I'm not in a healthcare setting and I'm going to the grocery store, I'm wearing a KN95. When I'm in seeing a patient, I wear a fit tested 3M medium without facial hair to make sure that I have a good fit. So very different supply, very different mask, very different usage.
Thanks, Scott, for that. Lacey or Andy, did you have any updates on where we are with our numbers on the 10 million masks, or maybe in the next 15 minutes you can provide an update?
We are very close. We
Okay,
are, last check, about 9.8 million masks out the door since the January 4th announcement by the governor. So we expect within the next couple of days to be well over that 10 million mark.
Great. Thank you, Andy. Okay, Corey.
And I'll jump here and just say, if you have additional questions or interest in PPE, you can visit doh.wa.gov/PPE for more information. Our next question comes from Dory with Northwest Public Broadcasting.
Thank you for taking my question. I have a question regarding compliance in public schools regarding the mask mandate. Is the Department of Health going to enforce the mask requirement for masking in public schools? And please explain the steps of enforcement if school districts begin to stop requiring masks.
Yeah, thanks for the question. I can take that. So we certainly recommend, and actually in Washington State require, universal masking of all students and staff in private and public K-12 schools. This is because there is clear and growing evidence that masks are an effective tool to slow the spread. Following, this is a good a good but serendipitous sequencing of questions here. In schools in particular, there are two studies that looked at mask wearing and differences in spread. And they looked at one looked at schools in Arizona where there's not a mask requirement, but some local districts required masks. Those that did not require masks of students were 3.5 times more likely to have outbreaks in their school in the start of this school year. There is another study that was also published by CDC that looked at pediatric case rates and found them to be lower in districts that require masks as compared to those that don't. So this is a requirement statewide. In terms of your question, there are enforcement tools here. So when the department or state gets complaints, or we learn about a school or district, because this applies to private and public schools, that is not following the state's health and safety guidance and in compliance with the governor's proclamations around COVID-19, there's a team, and it includes the Department of Health, it includes the Department of Labor and Industries, as well as some other state agencies. On schools in particular, we work with the State Board of Education and the Office of the Superintendent of Public Instruction. We generally, when there are, and this is not limited to schools, this is to any business or COVID-related violation, we try to start from a place of technical assistance and making sure that entity understands what the policies are and help them with practices to follow the requirement. However, if they do continue to not follow the requirements, there are enforcement actions that can be taken. And in schools in particular, very severe. We would not want to do this for many reasons, but there is the possibility that schools could lose some of their funding. And that is kind of the channel for public schools in partnership with the Office of the Superintendent of Public Instruction. And for private schools, they can lose their ability to operate in the state of Washington. That is conferred to them by the State Board of Education. I appreciate the question, Dory. There are enforcement channels. I do also want to note that any individual can report a COVID violation in a school or otherwise on coronavirus.wa.gov. So for schools, that could be staff who work in the schools, it could be parents and caregivers, it could be students themselves. And then that multi-agency team would research it and follow up.
Yeah, Lacey, if I could just add one thing, which is the incredible gratitude we want to give to our partners in schools at all the way from the superintendent at the state level, Chris Rickdahl, but also his teams, the superintendents, the school boards, the faculty, the people that are all throughout the system who are making sure kids are safe, parents, and then ultimately the kids. And I can't say enough about how difficult a time this is for everyone. And what we want to just make sure everybody just remembers is the absolute importance that we have given to in-person, in-school instruction. And that is so critical. So we're trying to do everything we can to be able to keep schools open safely in person, so kids will not have those consequences that we have seen over this pandemic in this country with people with remote learning. And so we just want to make sure to emphasize just the gratitude that goes into this. Is not easy. No stretch of the imagination is this easy at all. And many of us on that you're seeing on the video here have kids that are in school or just gotten out of school. And I will tell you that we as parents know how important this is for not just our students, our kids, but also for our entire families. And so we are committed to doing everything we can to work from a public health system standpoint with our education partners. And I just want to say thank you to them for just all the incredible work that they continue to do.
Yeah, and thank you, Dr. Shaw, for adding that. I also want to emphasize the overwhelming majority of schools are working extremely hard to do these layered mitigation measures to keep their staff and our students and our young people across the state of Washington safer in a really challenging time. And you know, if you look at our own state's data, there's evidence that they're doing a really good job of this. There have been very few closures of schools through Delta and Omicron waves. And that is because school leaders have stepped up, the school staff have stepped up, students are doing a great job at wearing their masks, parents are supporting them, and that makes a difference.
All right. Our next question comes from Sally with South Seattle Emerald.
Hello, thank you for this briefing. I wonder, is there any data that you could give me that's by zip code on the distribution of test kits from the state?
No, we cannot. At least at this point, we cannot. Lacey, I don't know if you have any additional details, but you know, we've been so focused on making sure we could get the test kits out. We haven't really compiled the information about, you know, the zip codes, things of that nature. Obviously, when we get to the point of near the conclusion of the 3.5 million, that was a time frame we were going to continue to look and make sure that there were no areas that were missed. But I do want to just emphasize that this is not, it has been a self-ordering system. This is not a, we are directing the orders in certain communities. We have, again, in addition to the 3.5 million, there were additional 2 million, approximately, give or take, 1 million for schools, 1 million for local partners. And so there we have been focusing our attention on which communities that we feel that may need more at-home tests or have a need, or they've described a need or an issue or a challenge where they're having trouble getting the tests for their community members. So we have a number of different programs going on, or initiatives going on, but not necessarily for the 3.5 million at-home test ordering, which is really opened up for Washingtonians. And I would be remiss, and Lacey may have an additional comment, but I would be remiss if I didn't remind everybody of the U.S., the federal government program for the 500 million tests that were also in play. Those are still, my understanding, open to people to be able to order. And why that's important is that we want to make sure that people are availing themselves of all opportunities to get tests. This is not the only way to do that, but this really allows for our ability to get tests out, but there are additional modalities that people can get tests from. So we want to make sure people are utilizing the tests, absolutely, in the right settings. We want to give people the information and the tools so that they can make the right decisions. But at the same time, there are a number of different places where people can get tests from. So Lacey, I don't know if anything you want to add to that, or does that kind of cover it?
I think you covered it. If you weren't on earlier, Sally, the federal site is covidtests.gov it's a plural, tests.
Our final question for today comes from Elise with the Seattle Times.
Hi, everyone. Thanks so much for doing this. I wanted to see if Dr. Shaw or Dr. Lindquist could share a few more specifics on trends in Eastern Washington. So specifically, are cases and hospitalizations rising as quickly as they did in Western Washington? And are transfers from Idaho hospitals still a concern?
Yeah, Scott, I'm going to let you do the specific trends. I will make a couple of comments since I know this has been brought up a couple of times, Elise, related to Idaho and our public health colleagues across the border in not just Idaho, but Oregon and other places. We continue to be in touch with our public health colleagues at the state health agencies in Idaho, in Oregon, even in British Columbia, and as part of our Region 10 program, as well as that includes Alaska also. And so we're doing a lot of really just information sharing of what's happening, what's occurring. And we know the challenges that are occurring not just in our state but across the region. This is a really difficult time for every state, but in particular, our focus as the state of Washington is Washingtonians, and we are doing everything we can to support our healthcare system within the borders of Washington. I will tell you that I know that there are times where somebody from Idaho maybe driving across the border and coming into a Washington hospital. And I'm sure there are times when a Washingtonian is crossing the border and going into, let's say, Oregon. And that happens all the time. But I think what we're doing is right now focusing our attention on supporting what's happening with the healthcare system within Washington. And obviously, when that healthcare system is stressed and shortages of whether it's staffing or staffed beds or just ways to take care of patients, the incredible stress that's occurring within the healthcare system, it's a time likely where transfers from other states in the region or beyond are more difficult to accept. I mean, Washington always traditionally has been an open state when it comes to helping our neighbors, but it's very difficult to do that when right now we're also in a very difficult situation within our borders. So I just wanted to highlight that that's where the real overall trend is from our standpoint, overall stance is from our health standpoint. Now, where it comes from, where we are with specifics for hospitalizations, Dr. Lindquist can add to this. I would say that we're seeing in Western Washington, not the numbers that we were seeing previously several weeks ago. Is really tremendously difficult. We're starting to it's tremendously challenging still, don't get me wrong. It's the equivalent of if you're driving on a freeway and all of a sudden you take your foot off the accelerator, your car is still going to keep going for some period of time before it starts to truly slow down and stop. I mean, what has happened in the healthcare system is not something that just happened like 2 days ago or 4 days ago or 6 days ago. It is really a culmination of what's happened over the last several weeks. And that is something that's going to take time to decompress in Western Washington. We are seeing the trends in Eastern Washington lag, both on cases and then hospitalizations about a week or two after what we were seeing in Western Washington. But again, it's all an ecosystem. And so that's why we want to really help support, as our teams have said, across the state of Washington, all the healthcare partners that have just been doing an incredible job. And we want to just continue to support their work. So with that, Scott, anything you wanted to add on trends for hospitalizations for the Western Washington?
Yeah, just to answer directly that, yes, we are seeing a rapid increase in some of these rates across Eastern Washington. But I would caution us, Eastern Washington is not all the same. There are very big differences between Spokane versus Walla Walla versus Yakima. The hospital systems, the capacity, the bordering with other states are all very different in Eastern Washington, but Eastern Washington as a whole is behind Western Washington hospitals and testing, but it looks very similar. It's just about 1 to 2 weeks behind.
Corey, is that our last question?
That's what we got. This concludes the question and answer segment of our briefing. We'll go to Secretary Shaw for closing remarks. Take it away.
Thank you, Corey. Well, again, I just want to thank my colleagues for being on this briefing. Thank you, each of you, bringing some level of specific attention to focus areas. So I just want to say thank you to you all and the teams that you represent. So just want to say incredible work by continued work by the Department of Health teams and our partners across the system. I also want to thank our media partners for being here today, as always, for championing the messages to our communities. And you've done an amazing job over the last year plus that I've been here, and I know 2+ years since this pandemic began. And I really frankly want to thank Washingtonians. I want to close by just saying thank you so much for what you have been doing. This is the the beginning of a new year. It's the beginning of a new lunar new year. And obviously we have so much that's happening within our state, and we cannot do it without all of you. But we still want to ask you to continue to be safe as you partake in your daily activities. Please make sure if you are exposed or you test positive or you have symptoms that you stay away from others and you follow the guidance. Please get vaccinated. Please get boosted. Please make sure your kids are also doing the same. And then certainly the key message for us is we know that this is a difficult time and it's going to continue to be challenging for all of us, but let's keep working together. And so with that, I just want to say thank you again. And Corey, I will turn it to you as representing our media teams who have also done a great job, and just want to thank you as well.
Oh, we appreciate that. This concludes today's media availability. I'd like to thank our panelists for their time today and for all of you for joining. And then lastly, big thanks to TVW for hosting today's live stream and archives of past briefings at tvw.org. Thank you and take care.